the Caribbean have selected some key priorities as it relates to governance and leadership. Education is one of the education and training. They have also as access and quality and finance.
Is the issue of migration and healthcare workers. It is something that is affecting the region of the Caribbean, and it is affecting us in a dramatic way in that we are seeing increased shortages in our essential workers.
The retention of staff, human resource, is one of our key issues in almost all the member states. And we have human resource staff moving, they're migrating. Some of them are retiring and not being replaced. And some of the key issues or some of the problems that they have identified are simple little things that we think that could be addressed. Things like remuneration, that is one of the issues. We also have persons deciding that they want to move because the work environment is not sustainable or it's not conducive. One of the other areas I think that persons have been moving because they think the lack of opportunities to move up, and also not just for mobility but for training. If they feel that they are not getting enough training, they want to move.
Personnel matters and human resources are very dynamic. It's an iterative process, and I think you have to have real-time information at your fingertips to make decisions. I think with a strengthened human resources information system, that we will be able to make those decisions quicker because we would have the information at our fingertips and we can quickly see the gaps, and then we can come up with better strategies for dealing with the problem.
We are continuously looking at improving our HRH health information systems in the Caribbean in order for us to be able to gather appropriate data that we can use to inform policy decisions, and so that we could have targeted interventions.
I think if you have a very effective data system, you could actually identify the gaps in human resources. And I think it also helps us to characterize the human resources needs and priorities.
It will help us to have access to quality data. It will be available, and then probably improve our use of that data.
We have a high level of fragmentation when it comes to data sources. And we have not able to integrate or collaborate well with the different stakeholders and map those who are involved in human resources for health management.
Another problem that I think as member states we experience is the fact that while we have available data, it is not accessible in the prescribed method that we would want to collect the indicators that we have decided on.
So with the NHWA data, we are able to compare Canada with other peers country and in a standardized and comparable manner over time. And this also highlights the strength and the area that we can improve on in terms of data and information as a country, and to better inform decision making and also policy development as well.
It would give us a better understanding of our human resources in terms of the distribution, the size, and characteristics of those human resources. It would also help to strengthen our information systems for policy decisions, also in terms of research for better policy decision making.
I think the tool is very comprehensive, and it helps countries and the region to be able to gather appropriate and pertinent data on HRH that we can use for policy development. We can also use for planning. We can use it. One of the most important point that we can use this information for is for investments in HRH.
We realize is that it can be a platform that can be used to both collect the data, analyze the data, report on the data, and this can inform the strategies and the policies that we develop to address the critical human resource for health issues that we have.